And with that, we will open up for questions.
Dr. How and Director Smiley, from a personal standpoint, how nerve-wracking was it to go through the quarantine and the threat hanging over your head of possible infection?
It wasn't necessarily nerve-wracking. It's definitely equipping, so to speak, to have the information and know this is what we may need to be prepared for. This is the behavior change that I need to be able to make. When you're testing regularly, you're anticipating that that information will come, and it allows us to be prepared to talk about what we're going to do and do the things that are needed to make sure that our household's protected.
No worries on your part?
I mean, of course, you're hoping that you do well in getting through the symptoms, but I was very thankful to know that both of us did well in that regard.
Doctor, how concerned should we be about the new variant in the UK? And for the governor, do you think the US should put new travel restrictions, as several other countries have done on the UK because of this new COVID variant?
Yeah. One of the keys that's important with this new variant is the tools that I just talked about today still work. So we know we can continue to get tested, treatment, the vaccine works against it, wearing your mask is still most effective. It doesn't change any of the action steps that we can take to do it. We are working closely with CDC, had a call yesterday. Our neighboring states as well are continuing to communicate so that we can understand what variants we have here, whether or not it's here or not, and anything to do differently. But the response to it stays the same.
And Governor, travel restrictions, other countries have done so. Do you think the federal government should follow suit?
You know, I agree with the doctor. I'm not inclined to do that at the moment for Rhode Island. I think that everything that we are doing with mask wearing, distancing, et cetera, ought to be effective. But we're in touch with the CDC, and we'll follow their lead if they direct differently.
In regards to the new COVID relief package, I know it's still new, but any word as to how much Rhode Island may be getting?
We are still trying to figure that out. Do you want to? We are literally, the president hasn't even signed it yet, and we are in the process of digging through it. We know we will get some money for testing. We know we'll get some money from vaccines. We know we'll get some money for K through 12, which is fantastic. The exact amount we don't yet know, we haven't figured out, and the exact amount per category we haven't figured out. The thing about which I am maybe most excited is that rental assistance. So there's, it looks to be like there will be a substantial amount of money for Rhode Island for rental assistance, which we are, desperately in need for.
I would add one point on the rental assistance questions. The CDC eviction moratorium has also been extended to January 31st now, which is a terrific benefit to Rhode Islanders who are facing eviction. To set everyone's expectations, it'll be a week or two before we really know, and maybe longer in certain categories. My team will be working through the holiday to understand the Rhode Island impact, but as we learned last time, there's also the potential that there'll need to be new guidance, new rules written. So some of these things could be many weeks before we know exactly how it will apply. But it's good news. There will be additional help on the way. We hope that this is one of several future stimuluses, because we know the need will outmatch what's provided, but it's a step in the right direction, and we're very grateful to our federal delegation for the work.
Nothing in the package for government operations?
There is nothing for revenue replacement or state or local aid. That's correct. There was certainly funding provided for things that we have budgeted and planned to fund, which will be a benefit to Rhode Island and to our response, but there is no direct state or local aid.
What's that going to mean?
Again, it's a little too soon to tell. Another couple of weeks, we'll be able to get a more accurate assessment of what's going to actually flow through to Rhode Island. But after the new year, we should have pretty good numbers to that, and we'll be able to give updates to that effect.
Going back to the $1.25 billion that you detailed, and the business support. I know you pointed out that Rhode Island has dedicated a higher percentage than the surrounding states, I assume, because you've heard the criticism from the small businesses that they want a greater share. Can you just detail why so much of it went to the hospitals, more than half of that $488 million to business and economic support, and $125 million to those businesses when they think they should get more, and kind of how that was formulated and why they couldn't get more?
Yeah. Okay. So you recall that in March, April, May, when we were new at this and struggling, we essentially went to the hospitals and said, stop your operations. No more elective surgery, no more non-critical surgery. And so as a result, their revenue, they had very little incoming revenue. And we can't afford for our hospitals in the middle of a public health crisis to go out of business. Also, they are our two biggest employers. Lifespan, I think, is the biggest employer in Rhode Island. It's a balance. I wish I had more. Like Director Smiley just said, I hope the federal government does more, because Rhode Island's economy needs more, as does, I think, the rest of the country. But it was just a balance. We had to keep our hospitals open, functioning, and financially viable. I'm sure if you ask the hospitals if they got enough, they would say no. But we did the best we could to keep their doors open. And then we did the best we could to make up for lost revenue for small businesses.
Governor Raimondo, as you're aware, just outside prior to this week's press conference, the Rhode Island Coalition of Wedding and Event Professionals held what I call an informational picket line. It was quite provocative. Their concerns and needs are, in one way, very similar to just about any industry in the state, yet they're also very unique. They are a significant driver of tourism, and at the same time, because of the going forward nature of deposits and how their business is structured, they are bleeding, in one case, more so than anyone, because of the air of uncertainty surrounding when they'll be open to their business, and then the projected lead time necessary for them to even be booked. Their concerns are, number one, that a number of them have yet to receive any of the pause money, but they're also asking for an in-person meeting, as well as either a date certain when they can resume, if you will, uninterrupted business, or at least a set of objectives that can be met so that they can inject a degree of certainty into their operations. Yeah. What would you or Secretary Pryor have to say to that?
Yeah, I'll offer overview, and then Stefan can offer some details. So, first of all, I hear where they're coming from. You are correct in that these businesses, certain businesses, have been disproportionately crushed in COVID, not just in Rhode Island. Commercial real estate, hospitality, wedding planners. It's the nature of it. Airlines, we don't have any airlines here, but you're correct that they've borne the brunt of it. That's why, unlike really, I think, any other state or most states, we made our direct relief available to individual sole proprietors who do photography, makeup, florist, and such for events. Having said all of, as it relates to a date certain, I can't give that. I really wish I could, but I cannot give a date certain. Right now, the slide you saw, this is a good-looking slide, which is to say, this is where we were a few weeks ago, and this is where we are now. I can't even think about relaxing regulations until we get to that 5% and until we vaccinate some more people. So I wish I could give a date certain, I can't. I will say that it is my belief, based on everything I know now, that by, late winter, early spring, we're just going to be in a much different place in terms of our stabilization and how many people will be vaccinated. The last thing I'll say is, this is a national crisis. I mentioned airlines, hotels, and I do hope, I think some of this stimulus that we're about to get, we're going to be able to use to help these businesses, and I can promise them I'm going to be as creative as possible to find every penny that I can to get out the door to them. And I hope the federal government does something else, because it's going to be a long recovery for these businesses.
Just to underscore what the governor said about the PAWS grant program, we are pleased that the governor specifically included event professionals in the program. Over 1,500 checks have now been mailed out or deposits made. Over $35 million worth of pause grants have gone out. And event professionals, including event planners, wedding planners, including photographers and videographers, including makeup artists and beyond, were included in that program. So Rhode Island stands out among states that have, in the midst of those restrictions, nonetheless found the way to provide resources to these event professionals. That said, I'm right with the governor that it isn't enough. We have to do more. Within the past 2 weeks, as to your question about meeting with event professionals, I've met with the organizers of the event professional dialogue and advocacy. Within the past 2 weeks personally, I've met with them, and I'm actually meeting with them again this week if there's a scheduled meeting with them, and my team has met with them earlier this week. We're continuing to brainstorm in anticipation of the time when larger events are possible. I will say the governor and Dr. Alexander Scott were very kind and thoughtful in allowing for events to proceed post-pause, up to 15 people with pre-scheduled weddings also permitted to proceed. Those are very small. Those are catered events only with specific guidelines, but in the midst of the public health crisis that we continue to be in, it's great. The last thing I'll say is we need to work towards better. That's only a start, even with the financial relief. So one tool is testing. Both the governor and Dr. Alexander Scott have emphasized this. One of the things that we're starting to do in the pop-up testing context is look to individual establishments and individual businesses. And one idea that the event professionals have brought forward is that we'd like to pilot doing testing at a catered event to see if that is something that we can accomplish on the spot and whether that will give us greater confidence in the future to open up even more.
Okay, follow-up, sir. Are there still checks in process for these people?
Yes.
Is there a date certain, if you will, when they will receive those? And one last question, is the state considering, and would it be projected across all industries, the relaxation or at least the temporary elimination of filing fees, licensing fees for industries that literally need to continue licensing but aren't allowed to operate legally?
I'd say on financial relief for small businesses, we're looking at an array of options, and it would be too soon to say what options are available going forward. But on the question of the additional checks, we have over 2,000 applications for the pause grants, and the remainder of the checks will be sent out. Of course, there'll be a substantial additional mailing of checks on Monday the 28th.
Governor, you said...
Just want to add on to that. I would be open to that. I'm not saying yes, we'd have to work with the legislature, it'll cost money, but I want to be clear that next year is a year of rebuilding, right? 2021 is a year of rebuilding. And I think, like I said before, we need to be as creative as possible, whether that's relaxing permitting so they can keep doing things outside even after COVID, whether that's licensing fee forgiveness, et cetera. These are all ideas that I'm very open to because we have to help try to get back on their feet and try to make up for next year some of what they lost this year.
Governor, how concerned are you? You sounded very upbeat today. We've turned a corner. You credited the pause. As you say that, Governor Baker is now imposing more restrictions for the 2 weeks after Christmas. They're somewhat similar to what you have in place now, but how concerned are you that the 2 weeks after Christmas are going to be a problem, just like after the other holidays, and that the numbers could just turn right around, as some medical experts have warned?
So look, I live concerned. I'm going to be concerned until we're all vaccinated and we're fully out of the woods. So to say that I am light about this, I would not agree with, but I have some relief because, as I said, this is a good picture, right? This is a good picture. Now, Governor Baker chose, and by the way, I am not criticizing him because he's doing a great job running his state, and this is brutal to make these decisions. He chose to wait a little bit to hit the pause button. I bit the bullet and paused early. And as a result, we're seeing some pretty good results. So we've also massively ramped up our testing. So am I concerned? Yes. We still have a lot of restrictions in place. There's still pretty serious restrictions in restaurants, pretty serious restrictions everywhere. So I like our chances. People listen to the pause. If they listen to the regulations, we're going to be fine. If everyone goes out and has a big Christmas Eve dinner and Christmas Day, then we're going to be in trouble, and I'll be having to pause again.
And just to follow, do you think much of the pause is credit for the pause is because you restricted the businesses, or because it was the message about how serious it is by doing that? And would you have to go back to more restrictions?
Yeah.
Weigh that balance.
So great question. Both. I bet definitely both. It was a seriousness of message. People got the message, but it's both. I mean, it's a fact. If I didn't bore you guys with all the details of all the data, but mobility is way down. Like when you can't go out to a bar or you can't go out to wherever, there's less reasons to leave, less reasons to congregate. If the curfew, if restaurants close at 10 or 10:30, mobility goes down and the cases look better. And also, it was the seriousness. Listen, I won't hesitate to go back to a pause if I need to. We cannot overwhelm our hospital system. Right now, our hospitalizations we have stabilized. If we can stay stabilized, then we won't pause. I don't want to pause. Like, I'm not standing here planning to pause in the weeks after Christmas. If we get to the beginning or middle of January, it looks like nobody followed the rules over Christmas, then I'll have to pause.
Governor, a couple of questions. One, concerning the pause in the hospitals. At this point, what sort of census do you have at the field hospitals? Are you seeing that declining? Is there an opportunity maybe even to close one of them? And the second question actually involves a situation that happened yesterday. It was funeral arrangements for Russell Freeman at St. Kevin Church. And at that event in Warwick, I would estimate that there were at least 150 law enforcement officers showing their respect, which raised the question on the part of other funeral directors. What is the message here? Because they are faced in telling families, we have to restrict the number of people, and here the rules seem to be bent.
Yeah. Do you know how many are in the field hospitals? Yeah. I need to get you the exact number, John, of the number of people in the field hospitals. The hospitalizations are not declining. That I can tell you. They're going up. They're just not going up at as rapid of a rate as they were going up. There's no world in which I see closing a field hospital anytime soon. Like Brian just said, we're bracing for the holidays. I'm optimistic. People got the memo with the pause, and they're going to continue to take it easy over the holidays. But if they don't, the hospitals will be filled right back up again come January. So we have them. I want to give a lot of credit to Lifespan and Care New England and all those doctors. They're doing well. They're doing really well at the field hospitals. They're high-quality field hospitals, and we're going to keep them open. We're going to hope not to use them too much. The reality is we're going to have patients in there for a while, and so I'm happy we have them. That was it on that? And then on the funeral, yeah. I didn't, I was in the car procession. I wasn't actually at the funeral. I did speak to the widow a week ago, who is understandably devastated. By the way, that was our first state employee that we lost to COVID. We ask them, as we ask everyone, to follow all the rules. I don't know that they didn't follow the rules. And I would just say, first of all, my heart goes out to that family, as my heart goes out to all families. And secondly, listen, it's the same thing I've said about myself. We all got to follow the same rules, and we can't excuse anyone to break the rules.
Dr. Nicole, Alexander Scott, I have a question about the vaccine. You mentioned that you'll prioritize hardest hit zip codes, Central Falls among them. Do you know what phase that will fall in?
In the first phase.
Dr. On the phasing, the CDC's advisory committee said over the weekend recommended that the next phase should be people over 75 and frontline essential workers. As the state sort of formalizes its phasing, is it going to follow that?
We are taking a few, extra day or two to assess what CDC has recommended and balance it against what we had and the direction we were going in. I feel very strong about what we had in place. Our subcommittee vaccine advisory group has endorsed it and supported that. We'll see if there are any specific changes that need to be made and then make a decision from there.
I guess the big difference was they said rather than just people over a certain age living in congregated settings, they said 75 and above, really no ifs, ands, or buts about it, just because of the high proportion of deaths in that community for people who are older.
Right. Some of the things, for example, that we're assessing is the ACIP guidance where they just gave the first few groups. How does that align in timing with ours? Because we do have seniors of any age early on in the second phase. So the timing may be aligned. We want to make sure that we continue to be thoughtful in how we're doing it, making sure seniors that are at highest risk, seniors that are in long-term care facilities, the home health aides who are taking care of seniors are all vaccinated early. And then we'll make any final determinations about any adjustments to make, but we feel pretty strong about the thoughtful approach we have in place now.
Doctor, do you see CVS and Walgreens administering the vaccine in the weeks to come?
As part of the nursing home program.
As part of the nursing home, when it gets to...
Oh, just overall? Right. We have all partnerships on the table. Once we get to the subsequent phases where we need to vaccinate as many people as possible, we want to be as creative as we can, and absolutely pharmacies that are valuable partners like CVS and Walgreens will be a part of that approach.
Thanks, everyone.